As we get older, we lose volume in our face, which can age us and give us those dreaded wrinkles and sagging.
Yes, but thanks to new technology and Dr. Cadu at Greenspring Medical Aesthetics, you can magically reverse those signs of aging with some relatively simple procedures. And he is joining us now in the studio to tell us about some of them. Good to see you, doctor, as always.
That's great to see you both.
So let's talk about the liquid facial sculpting.
Yeah.
What is facial sculpting?
Facial sculpting is taking a particular feature and changing it to something either different than what you have or restoring it to what it used to look like.
And, you know, patients, I mean, I'm sure, you know, range in what they want to do. They might want a little more drastic change. They might want a simpler one. And you've brought before and afters that sort of demonstrate a little bit of both. So what are we seeing here?
Well, here we're seeing a woman in her early 40s who's lost volume under the eye. You can see on the left photo that there's a depression there, and it causes, that loss of volume causes the lower face to sag. And all we did is a very simple procedure is I restored the volume there under her eye, and it gives a more youthful appearance to the eye and to her face in general.
Typically because we lose collagen, I would imagine, right? I mean, we always hear the older you get, the less collagen you have, and that's what changes your face so much.
And fat, because there's a lot of facial fat. If you look at a young person, they have a lot of fat in their face. I mean, we don't consider them fat, but it's fat that gives us beautiful cheekbones. Look at a 16-year-old.
Right.
You know, beautiful cheekbones. Not much fat here, nice fat up in the cheek, you know, not in the jowl. And so we restored the volume where we've lost it. In this photo here, this lady lost a lot of volume in her chin. She has a crease over the top of her chin under her lower lip. And on the on the right side photo is after a simple in-office procedure taking 10 minutes. You can see how the severity of the lines and loss of volume there has been improved.
Because those laugh lines sometimes make us look sad or way too serious, and that's just what happens over time.
That's right.
And it's amazing how one area of the face affects other areas. Right? That's why you selectively treat certain spots, right?
That's right.
Because then they can help support another area.
Exactly right. Volume put here in the mid-face literally resuspends the lower face. So we don't need surgery to pull this skin up.
Because I would always think if you put more fat or filler in your cheek, then it would be heavier and it would go down, but it actually has the opposite effect.
When placed at the proper depth and in the proper anatomic position, it lifts the face. If it's placed incorrectly, it will weigh the face down.
Wow.
So it's important to be placed properly.
Such an exact science.
Yes.
I love it. And so we're talking to you about a liquid nose job. Describe that to us.
Well, some people don't like the contours of their nose, if they've had nose damage. They don't want to go through surgery. And there oftentimes we can really, in a simple in-office procedure, change the appearance of somebody's nose to their liking. And I think we have a photo of that here. I can give one example. So here's a person who has a flattened, broad-bridged nose and doesn't like that. There's nothing wrong with the nose on the left. That's just not what this person has in mind for themselves. So we use dermal filler there to create a ridge line to the nose, making it a little more refined and a little more angular.
I'm sure you get a lot of people coming in who've wanted to do this for a really long time and are very happy to know that this is pretty non-invasive.
That's right.
Don't have to undergo the knife, so to speak. So let's talk about some of the lip enhancements that you can do, because the lips get lines the older that you get, and that really shows age.
That's right. Lips, the lower part of the face, in the chin area, we saw that picture before, and the lips lose a lot of volume as we age. It's normal. So-called smoker lines occur naturally. They tend to be worse in smokers, but non-smokers will get them often anyways. And so we restore the volume in the lips, which basically stretches the skin over that restored volume and is a very natural look. Lips are very, very artful. They require a lot of artistry to do them properly, or they can look silly. The idea is get the lines gone, lips restored to original volume, and have it look like you didn't have your lips done. So here's somebody with a severe brow line. This isn't an 11, it's a 1. And that Botox will help, but that person needs dermal filler. So we resculpt the volume that's been lost, add Botox. They no longer crush with the Botox. They no longer crush that skin. That deep furrow there occurs because the skin has been crushed over many years.
You know what? It almost looks like Photoshop. Like
Yeah.
someone went in
Right.
with Photoshop
Yes.
in real life.
That's
But that's
right.
one of those things too. It's like they look angry sometimes,
right.
even when they're smiling. You know.
That's right. We have a lot of elementary school teachers who come and say the kids think I'm angry. They just don't understand.
Right.
This is stress
that's
up here.
right.
So, well, you just have a way of making us relax. I mean, if you're getting work done like this,
Right.
you want somebody who's going to put you at ease like you, somebody who knows what they're doing, has years and years and years of experience, more than anybody west of the Mississippi, like you said another time. So, as always, pleasure to sit down with you and chat.
Great to see you both.
Nice to
Thank
see
you.
For a free complimentary consultation, or if you're curious about the procedures done by Dr. Cadieux, check out one of their 2 Greenspring Medical Aesthetics locations. You can call 520-628-8500 or visit greenspringaesthetics.com.